afternoon and welcome to this March 11th, 2020 council work session. And we are missing a few councilors, but all of them are healthy. They are all doing other things.
I'm not sure I'd go that far, Mayor. I'm sorry.
So not to worry. And Manager, I'll turn it over to you.
Yeah, thank you. So we had an opportunity to update some of you or the budget committee members and council at our budget workshop a couple weeks ago. Just kind of had an opportunity because the chief was there. But as COVID-19 continues to be in the news and on social media, we know a lot of people have concerns. I'm getting a lot of questions from community members, from businesses, with kind of a general theme of what are you doing to take care of us? I think that's really it. And we're using it as an opportunity. I think it's just really important that we stay calm and we work through this in a really professional way, but that we use this as an opportunity to really test our systems and to make sure we're prepared. So we have things in place that we'll be doing to try to get your laptops updated so you can meet remotely. We're doing that internally. So we're going to talk through a lot of that. I'm joined at the table with a nurse from Lane County, Cindy Morgan, who I believe is kind of in a lead position for the county on this effort, and Chief Heppel. So I'm going to turn it over to Cindy. She'll walk through kind of what's happening at the county level, and then Chief, and then we'll have questions and closing.
Great, thank you.
Hi, I'm Cindy Morgan, and I'm the Communicable Disease Supervisor for Lane County. So what I would like to do is begin by providing just a short overview of the current situation with COVID-19 in Lane County. At this point, we currently have 12 PUMs, as we call them. Those are persons under monitoring. And what that means is these are individuals who may have been in contact to a case or are have had other reason for us to contact them and to be monitoring them for 14 days. And like I said, we currently have 12 of those individuals. 26 individuals or residents of our county have already completed monitoring. We also have persons under investigation, and that the description or definition for that is individuals who have some symptoms of COVID-19 and are being tested. We currently have 20 people who have completed that testing, and as you know, Lane County has been fortunate enough to not have any positive tests as of today. One of the questions that always comes up is, what does Lane County do? And this is certainly a more unique situation than some of them we've had in the past, in the fact that we do not currently have a vaccine for COVID-19. So COVID-19 is, by the communicable disease team, is just like any other reportable disease. We are investigating, we are contacting those who may be at risk. We are interviewing, sometimes, and monitoring daily. Our campaign at this point is largely around communication. So we are developing information for schools, long-term care facilities, just about every group that is coming to our attention. We are either developing materials and placing them on our website, or we are using existing materials that have already been developed by the Oregon Health Authority. Again, this is just like any other reportable illness that the communicable disease team would be investigating, just like hepatitis A. Except, as I said, we don't have a vaccine for that. So you may be interested in the Oregon numbers. Currently, Oregon has 232 individuals under monitoring, and as of yesterday afternoon, had 534 who had completed monitoring. And as of yesterday, we had 15 positives in Oregon, and 213 individuals who have been tested and who were negative.
Mayor, councilors, thank you for this opportunity to present the roles and actions of the City of Eugene during the COVID public health emergency. The city works in cooperation with our national, state, and regional partners to protect the public health during these health emergencies. During a public health emergency, Lane County Public Health, in conjunction with the Oregon Health Authority, is and are the lead agencies. As a cooperative agency, during this emergency, our first role is to support and amplify the messages, recommendations, and proposed preventative measures of the lead agencies. This is not the first time we've been in this cooperative role. Staff has coordinated previously with Lane County Public Health and Oregon Health Authority with the swine flu, H1N1, and Ebola when they presented a threat to public health. We are maintaining joint communication with our partners by participating in daily, weekly calls with Lane County Public Health, Oregon Health Authority, Lane County Emergency Management, and the Office of State Fire Marshal. Our second role is to maintain critical and essential city services. While our partner agencies are responsible for services such as fresh water, trash, wastewater, and electrical services, we have an obligation to maintain city services such as, but not limited to, governance, central administrative functions, public works, emergency management, and public safety. The City of Eugene has existing emergency management and operation plans which will be implemented as needed to ensure our ability to maintain critical and essential services as well as support state and health county efforts. Currently, we're in a mitigation phase with a focus on prevention and precautions in an effort to reduce the spread and manage the impact to the healthcare system. Additionally, our goal is to reduce community anxiety by encouraging the community to be informed, follow prevention practices, be prepared, and taking precautions to support those at higher risk. So what are some of the current city actions? And I'll take this from both internally as well as externally. Internally, we have a responsibility to keep staff updated and informed. One of the most important roles our staff has is to ensure accurate information is being provided to the community. Our staff interact with thousands of people every day, and we want to make sure that they have the correct information to share, help dispel any misinformation, and reduce any stigma or stereotyping. While email is our primary means of communication, we are also facilitating a weekly discussion with division managers via conference call on Fridays to answer any specific questions they may have. Workplace hygiene and well-being are other areas of attention. Staff have been instructed to increase office area cleanliness by focusing on touch points such as door handles, push plates in public areas, encourage hand washing, actively encourage sick employees to stay home, and providing remote working options if needed. Recognizing we need to maintain a working city, our emergency management program addresses our Continuity of Operations Plan, or COOP. Continuity is our ability to provide uninterrupted critical services, essential functions, and support while maintaining organizational viability before, during, and after an event that disrupts normal operations. Our Continuity of Operations Plan establishes policy and guidance ensuring that critical functions continue to include city governance. At the department and division levels, plans include procedures for alerting, notifying, activating, and deploying employees, identifying critical business functions, identify and establish alternate facilities, and appropriately assign personnel with authority and knowledge to manage critical functions. Now let's take an opportunity and look what we're doing externally. From the first responder perspective, protocols are in place. The current guidelines for first responder protection are parallel with current protocols when responding to calls for sick persons with flu-like symptoms and fever of unknown cause or etiology. Our first responders have the proper personal protective equipment, or PPE, training and protocols they need to protect themselves and their patients. The flu is common to the 911 and emergency medical services community. Annually, we will see a rise in calls with flu-like symptoms, and then the 911 center implements what we call our flu card. This card directs call takers to ask additional questions around flu-like symptoms. If the caller reports symptoms, the dispatcher advises responding crews so they are prepared to take appropriate actions. The flu card was implemented this season back in November, and we continue to run it today. On March 2nd, at the recommendation of the lead agencies, the 911 Center added additional questions to the flu card addressing recent travel and proximity to confirmed COVID patients. Again, this information would be forwarded to crews if that information was received. Last week, the local EMS community implemented and improved personal protective equipment through a decision-making chart. Additionally, we conducted an exercise with both Peace Health at Riverbend and McKenzie-Willamette hospitals. This exercise simulated a confirmed COVID patient who required transportation to the hospital from their residence, and the goal was to exercise that safe initial contact, treatment, transfer, and then transfer of care at the hospital using safe practices. Please note, to date, we haven't seen an increase in 911 emergency medical services call volume or respiratory emergencies associated with this health emergency. Clearly, protecting community members within city facilities is another priority. Last week, based on lead agency recommendations, staff intensified cleaning protocols for city facilities. Facility staff have modified routines and increased cleaning frequency in city buildings to help reduce the potential spread of the disease. Buildings that have facilities with a custodial presence during the day, such as EPD headquarters, the Campbell Community Center, and the pools will receive additional cleaning services periodically throughout the day. Public city facilities, such as community centers, pools, the Holt Center, and the library currently employ protocols for thorough daily cleaning and post-event cleaning to disinfect the facility after classes, activities, and meetings. They have increased the frequency of this cleaning as well. At the Eugene Airport, a robust cleaning and sterilization protocol is in place. Terminal staff use a vitricide several times a day to help disinfect and contact areas throughout the terminal. Lastly, I'll finish with some communications. Our current communications plan moving forward is to continue focusing on and reinforcing public health messages and sharing what we are doing. The city website has a banner pointing to Lane County Public Health as our recommended source for information and frequently asked questions around COVID-19. Additionally, the city website has information on what the city is doing and links to other information resources, including the Oregon Health Authority, the Center for Disease Control, and a letter from the city manager. Additionally, we are employing social media as appropriate. At facilities, disease prevention practices are being posted in the city's public facilities to encourage CDC preventative measures or methods practices. Larks has opened a department operations center specifically focused on communication to make sure that they are keeping patrons and staff up to date and to assure efficient and consistent communications. Please note the slide where more information can be obtained. Again, Lane County is currently in a mitigation phase, and we may not progress further. While you might hear different messaging from other communities, other areas may be expecting a different impact or experiencing a different impact from COVID-19. In Lane County, we are focused on prevention and precautions in an effort to reduce the spread and manage the impact to the healthcare system. Please encourage fellow community members to monitor information provided by the lead agencies, exercise prevention practices, be prepared, and take precautions to support those at higher risk. Thanks for this opportunity, and we're prepared to answer any questions.
And just before you jump into questions, one of the concerns I have is that after today's work session, you're going to be on break until April 8th, and this is a dynamic environment, so it'd be good for me also to understand what kind of communications you're going to want from me and frequency and things you want to know. So
That is great. Thank you very much. That was very helpful and reassuring, but we have a lot of questions. So I'll start with Alan and then Mike. Claire.
Yeah, I learned a new word today, vitricide.
Sorry.
I know that one. That means is something that kills viruses.
Yes.
What would that be? Like if someone wanted to buy something to clean their house or their businesses?
Sure, there is on the Lane County website, there is, I believe, a list of those appropriate products to use for cleaning. But basically, one of the bottom messages or the main messages is that it must contain for hand sanitizers, it must contain at least 60% alcohol content in order to be effective.
And then for sprays, for disinfectant, either hydrogen peroxide or Clorox?
Bleach solution does work at a 1 to 10. I tend not to say Clorox because we tend to use the term bleach. You may want to look at the containers to make certain that it truly is a bleach that you're using. But again, the website has a list of all of the approved products that can be used for cleaning in houses and facilities.
So I'm glad that there aren't any cases in Lane County. I suppose that's probably yet. Maybe you can answer this question, Chief. We talked about this at the Budget Committee. Like, why is it that this is different than other flus, and because of the community spread and the mortality rate? And maybe you can talk about that a little bit.
It's more of a public health question,
Yeah.
but I can certainly take a shot at it.
Okay, you start and I'll fill in the blanks.
Yeah. The concern is the virality of it and its ability to spread. That's associated with it. The good news is that we've been able to, or they being the CDC and the experts, epidemiologists, have been able to drill it down to that it's not airborne, that it is a particulate matter transferred. So that's good to know, which helps drive our protective equipment that we utilize, and the fact that we can easily maintain and clean it up the product and control it through simple hygiene and behavioral issues.
And I guess what I would add is this is an evolving situation. We are learning more and more about this virus on a daily basis. And so I think that part makes it new. We also, in the past, such as with H1N1, we quickly had a vaccine that we were able to use to protect our residents. And with this particular virus, we do not currently have that vaccine, and it may be a few months away before we indeed do.
Okay. So personally, people can wash their hands with soap and water for 30 seconds, way better than hand sanitizer. Clean surfaces with a vitricide, and avoid unnecessary crowds and travel, things like that. It kind of brings up a question of, we have a big concert coming to town tomorrow at the Matthew Knight Arena, where a ton of people are going to come to this place. Should we be concerned about that? What can people do to minimize their exposure, I suppose?
The only to minimize yourself in that component is social distancing, and that's a voluntary or a choice you make as an individual when it comes to that. We have no recommendations from the lead agencies to shut down venues or close any facilities or any of those types of issues. It's been very clear that we are in this mitigation mode, and that our role is prevention and encouraging preventative measures. The other piece is preparation if we do move on to another phase, and we would follow the guidance from the lead agencies associated with that. We also recognize there's a concern with a more vulnerable population, so those folks that are potentially over 60 years of age who might have comorbid factors, so pre-existing health conditions such as heart, lung, diabetes, suppressed immune systems would probably be at higher risk, and we should probably take some consideration in transiting or participating in those types of events.
Social distancing, 6 feet.
Yes.
Correct.
So,
There's a distance? Wow, I didn't know there was an official distance. That's cool, it's good to know.
not 5 feet 11.
Right.
Arm's length.
Right,
Twice arm's length.
Every other seat.
Yeah, every other seat.
that's why
We're sitting next to each other. Yeah, I don't want to fan the fear flames, but so eventually, I'm trying to get to what the authority of the city is in terms of, for instance, who has the authority to say, okay, in some places they've said no concerts, no conferences. I mean, right now it's on an individual basis, and the organizers do that. But from a governmental authority, how does that authority flow down to the city council level, and what authority would we have eventually? Probably we'd be preempted by state and action as before we got to us, or county.
Do you want me to answer that?
Sure.
Yeah, I actually had a meeting about this right before we came in here, because I predicted that. I was like, what authority do I have? So right now, it's really Oregon Health Authority in Lane County that would be able to say, hey, City of Eugene, you need to go shut this down, or Matthew Knight, you need to shut this down. We have, of course, the authority to shut down any of our venues that are city venues. So if we felt like the Holt Center was unsafe, I could just say, Renee, we need to not operate the Holt Center. Right now, we're letting the event organizers make those decisions while we kind of monitor in this mitigation phase. If we do get to a place where we feel like we need to declare a state of an emergency, there's a process for doing that that involves me and hopefully the majority of the council, but at a minimum, the mayor and one council member, and it's done through an administrative order process. So we're kind of walking through what that might look like in case that is something that would happen while we're on break.
And that would go beyond city-owned facilities.
Yeah.
So right now, U of O owns Matt Knight Arena, and a promoter does the concert. That's
I
up
think
to
the
them.
reality is it'll be the Oregon Health Authority. If it becomes that issue, I think that's where we're going to get the orders from.
Right, right. Yeah, I know in other places they've shut down and said people stay at home in different
Yeah.
places, like University of Washington, for instance.
Right.
Okay. I just wanted to get clear about how that would work. Thanks.
Hey, Mike.
Thank you, Mayor. I appreciate the report, and while it's good that we don't have any cases in Lane County yet, I think we do have a lot of concerned people and a lot of fear, frankly, in Lane County right now. And I think the best way to dispel that is to talk as openly and as frequently and as loudly as we can about what we know and what we think people should do. And we've heard some of that, but I think we should be doing a lot more of that. And along the lines of something that Alan just asked, I have read enough and seen enough and heard enough now to know that those most vulnerable populations are those that are over 65, for example, and have pre-existing health conditions. So why shouldn't we be temporarily either restricting the activity or closing our senior centers right now, which are group places for seniors to meet that might have a whole host of underlying conditions? Why wouldn't that be prudent to do right now?
We're working through that right at the moment. What the right time is to do that.
Right, and your phrase was, if we do get to a place.
Right.
Can you tell me about what that place looks like?
You're asking really good questions. I mean, you're asking the same questions I'm asking. Should I just be closing the city down, right?
Right.
Do you just close all the facilities? Is that the right decision?
And
And
I-
I'm definitely in a
Yeah,
taking information in
right.
and trying to balance what is the right time and the right place. And I think it's, for me, it'll be in consultation with the lead agencies, with the chief, with the other emergency managers, and we're talking about it pretty frequently. And I think as I've been using the term, and I hate to always have a sense of humor, but I'm going to teach you a new word, which is preparia, not hysteria. And that's kind of what we're trying to do, is just be really prepared so that we can do it. A lot of people are making those choices not to attend anyway, and we're advising them and educating and saying, if you have these conditions, you probably don't want to be in these places, but it's also, people have needs and they need to
Right.
go places to have those other needs met too, so.
You guys are having lots of conversations at the staff level, and that's awesome. I think we ought to have a lot more conversation coming out of the county's health authority, and that we at the city ought to be helping to add volume and repetition to that. I think the one voice of the county's health authority ought to be the clarion voice about information. I know there's a phone number, for example, staffed by 2 people 24 hours a day, I think, and, 9 to 4 or something
Yes.
like that, Monday through Friday. I think we should have that phone number as far and wide, social media and everything that we can, because my understanding is the county wants people to call. So I'd say, especially I'd invite our friends in the media that are here to put that phone number up and share that as widely as possible, because that's how you get good information, is to look at that. I think us asking tough questions at this table is a really good thing, even if we don't know the answers, because I think we give comfort to people who are scared if they at least know that the people sitting at the table are asking the questions and trying to get the information. And what we may not know yet, we're at least trying to become prepared for. I think that's a very good thing. So I have also seen something that shows that the desired transmission rate, and this will eventually make its way most likely to our community, is to spread it out and have the thing look like this as opposed to a stalagmite. And have this, because that's where you get health facilities overwhelmed without the ability to respond properly. So should we be talking about the city's appropriate steps to help encourage this as opposed to this? I mean, we're now going to not meet for 4 weeks, and I think our timing is really bad. I guess I'll need a second round. I'm already over time here.
All right, Claire.
Thank you. Thank you very much for all the work that you were doing. Chief, you used an acronym towards the end of your presentation. I think you said LARCH?
LARCS, Library Cultural Arts Recreation.
Thanks. Library,
Sorry.
Cultural, Recreation Services. So kind of alluding to what Councilor Clark mentioned, you know, our public spaces, our recreational spaces, our libraries, our community centers. Thanks. So just a little kind of broad couple of comments. You know, there's the recommendation from Oregon Health Authority that folks stay home if you're feeling sick. And I just will have to point out that Oregon is ahead in terms of that because of our statewide paid sick leave law, which most other states don't have, and that this council was partly responsible for helping pass that state law. So just wanting to point out to folks that if you are working, you should have some paid sick leave that you can call upon if you need to take time off. And also my own employer, the Oregon Nurses Association, just so folks know, there's a lot of work going on around the state around this. So the Oregon Nurses Association is working directly with Oregon Health Authority and also working to ask hospitals where we represent nurses to ensure that healthcare workers are being prepared properly, both for the working conditions they might find themselves in, such as mandatory overtime, and for protection of their own health. So there is a lot of work being done around the state that is mostly invisible to the general public. So I just wanted to share that little perspective. As far as communication from the city manager while we're on this break, you know, I'm getting the Oregon Health Authority updates and also updates from Lane County Public Health. And I think from my perspective, should things advance to where public health is recommending that we limit events or even, you know, that we're going to close down some of our own facilities, I would definitely want, you know, an extra heads up about that. And for the most part, I will be in town around during the break. So if there's an emergency meeting that needs to be called, I should be available for that. And then building upon what Councilor Clark was saying, I agree that I think there should be more public comments, perhaps from Dr. Lidke, the head of our public health agency here in Lane County, or in combination with our mayor, on all sorts of media. Written statements are very important to get detailed information out, but also having a human being speaking to the camera or on the radio is a really important way to provide reassurance as well as important information and will attract people's attention and focused attention in a way that a statement in the paper might not. So I just want to encourage us to continue working with our partners at Lane County around how we continue to communicate about all the work that's going on and how to stay safe.
I have Mike and Alan both wanting another round, but I just want to ask something else as well. We have received public testimony, we've received emails and suggestions concerned about the unhoused population here and providing some kind of sanitation stations, more robust sanitation stations. Could you address that and let us know what the county is doing? And I don't know if there's a city role to dive in there.
Well, I would say that Lane County Public Health is certainly concerned about our unhoused community members. One thing that we have noticed is that if you are downtown and spending a great deal of time downtown, there's not many places or opportunities for hand washing. And certainly just we notice that when we talk about other communicable diseases such as hepatitis A, which we recently have been having some meetings about in our community. So increasing the opportunity for our residents to have hand washing available downtown would be very important. One of the messages that we continue to say about COVID-19, but about every illness it seems like we talk about, is wash your hands and wash your hands often. And with COVID-19, we are recognizing that the spread could perhaps be stopped by about 40% just with the simple act of washing your hands. It's easy for me to say that's a simple act, But if we do not have the availability of soap and water to wash our hands, it becomes a more difficult act to complete.
You want me to say it? We actually, I met with the county this morning with Steve, and I know we're having a meeting tomorrow to talk about more public hand washing stations, and it's something that we're talking about internally as well.
Okay, that sounds, yeah.
I'd say another piece, Mayor, is that we recognize the problem in the Pacific Northwest in general with the unhoused component. And so I do know a group met on Friday, a local group that supports the unhoused communities and expressed their concerns. The state OHA has recognized that, and there's a task force, my understanding, being formed that meets tomorrow to start developing recommendations of what that would look like. The other piece we're hoping that comes out of that is sheltering recommendations. What does the sheltering component look like dealing with an unhoused component? So this is folks that are normally unhoused. How do we isolate, quarantine those folks versus someone who may be displaced from a specific event? So we're looking forward to that information coming down from that task force.
Okay, thank you. I have Emily for one first round, and then Mike, then Alan.
Thank you for all this work. I know a lot of people are worried, and a lot of us are just going on with our lives and waiting to see what will happen. I'm super concerned about this hand washing situation, as I have been since I started talking to you. And it's concerning that it's taken this to say that hand washing, which is the preventative for all illnesses, is finally getting some attention. We should be embarrassed about this, and we should have those hand-washing things out today. And I would hope that we would keep them out, because if we get a hold of this, we're not going to get a hold of all illnesses. And we owe it to our population to give them the simple remedy of water and soap to wash their hands. We will be protecting everyone in the city if we provide enough hand sanitation. And this is really serious, not just for now. And I'm bringing Sue Sierra Lupe with me to the table. Let's get this done. When we move after mitigation, what comes next? I mean, this is all great, saying let's not get it, but when the homeless get sick, they can't stay home in bed. So this sheltering idea is critical. Well, if the homeless get sick now with the flu, they can't stay home in bed. So I would encourage us to use this crisis as a model to get ahead of problems that we have been dealing with unsuccessfully for such a long time. It's going to take money to get that hand washing done. It's going to take money to get sheltering places. We need to do this already. So let's use this to do it well and fast. Thank you.
Okay, I'm actually going to let Jennifer have her first round before I get to you.
Sorry. So, off of what Emily said, so what is our timeline? You said there's a group meeting to talk about these things. Do we know what their timeline? Do they have access to funds? Is that something that needs to be? I mean, we are going on break, so this is our chance.
I can't speak to that specifically as to who's on that task force, et cetera, or that agenda. Certainly, as you know, the governor declared an emergency this weekend, which allows them to receive some fundings from Health and Human Services, so that will be a funding component. Where that will go and how that's utilized is up to the state at this point. So I don't have the answers to that.
Yeah, I can also say you're going on break, but we have a lot of appropriation authority existing, and we have a supplemental budget coming up. So if there's something that happens that we need budget action on, you'll be able to do that. We'll be responding as quickly as we can as this keeps evolving. Does that make sense?
Yeah.
Yeah. We won't need to call you back to get budget authority for a hand washing station.
Right, so if these folks identify we need this, this, and this,
Yeah.
you feel like you're good to be able to make that happen.
As long as it's within our existing kind of abilities, but we may need to come back to you with a way to refill that.
Okay, Mike, then Alan.
Thank you, Mayor. Some really smart people who I respect are on social media with much graver concerns than the tone and the tenor in which we're having this conversation today. You guys ought to shut all schools. You ought to shut down the University of Oregon. And where I understand their concerns, and I think there's some validity, some of that, obviously, you want to slow down and be measured about this sort of thing and intelligent. But as I look around the world and I see what happened in China and then I see what happened in Italy, I also look at Taiwan and South Korea where they didn't have anywhere near the same kind of effect, and it was in part because they took very stringent action very early. So why isn't that a lesson for us, and why aren't we considering, before the first case arrives here, that we should be taking much more precautionary measures now? I mean, as far as what I said before, why aren't we having, for example, some discussion around the idea of the community center amongst the large population of most vulnerable folks?
We are having those conversations. I think I mean, you're asking just really great questions, and I
Thank you
appreciate
very
that.
much.
I think it's just a moment by moment basis. Like, does the city of Eugene want to be, and I have to say, I think I'm probably on the more, let's close it side of the spectrum than maybe everybody else is, of like, what's the harm in just being prepared? Let's get prepared. But I've also know that in doing that, we send out a lot of alarms. We have a lot of small businesses in this community that have also expressed, like, if we close for 2 weeks, we may not be able to reopen. And we know that from all of our emergency
Sure.
management piece. So we want to be really thoughtful about it.
Yeah.
And also make the right decision when we need to make it. And I'm not going to be afraid to make that decision.
Right.
And I may err on the side of being more prepared, but I also don't want to just unnecessarily send businesses and community members into a space where they don't get the services they need, they don't get the businesses they need. So I think it's just, this is what we do. We just kind of take it hour by hour, day by day.
Our systems, all of them, from how we get food at the grocery store to the businesses that we work in, are all very fragile, and they all rely on a very short time frame of capacity. And so, yeah, it's really smart to be super thoughtful about this and to think carefully, because there's consequences for all of it. I couldn't agree more. I think that's the sort of thing we should be speaking about and talking about more frequently, because everybody gets that. Everybody's pretty smart. But when they don't know why we're not doing those things, that's the opportunity to say, we've thought about that. We think, we understand the importance of that. Here's why we're not, and here's the point at which we consider it more strongly. Here's the point at which we do it. I think those kind of things need to be on social media, need to be out and on the news media much more frequently and loudly than we're doing so far, just my opinion. So that, because I think that's the only way you'll get smart behavior from the general public and calmed concerns, is by seeing everybody that's in charge of the response here acting in a way that says we're on this. So.
Alan?
Yeah, I just wanted to let Sarah know that I'm glad you're on top of this. I have confidence in your ability to handle this and keep us apprised as much as you can. And so I'm glad you're all working on this. It makes me feel a lot more comfortable. There's also a context that this needs to be put into in terms of, what'd you call it, the
Preparia.
not hysteria, right? So far, we've got, less than 50 deaths from this in the United States. The average, I think, for flu is like 40 to 45,000 people a year die of the flu. In 2017-18, it was 61,000 people died of the flu. And 180,000 people were in 2019 were hospitalized for it. So, and we've got 1,000 cases in the United States. So let's keep that in mind as we proceed. I wanted to also talk about the homeless population and sanitation, and I think it's very important to have the at least temporary hand washing stations. I mean, we at the county fair and other events and concerts and stuff, we have these mobile hand washing stations. Let's deploy them and get them out there. I think should be a concern for everybody that if someone who doesn't have a place to stay when they're sick is wandering around, that is not a good thing to be promoting. So let's get that going as fast as we possibly can. So I completely agree with that. I wanted to ask another question. I was listening to NPR the other day, and I think this guy was from Harvard, and he was talking about the fact that he thinks that maybe this virus has been in our communities all along. We just haven't seen it because we haven't tested it and it hasn't shown up. And he kind of had an analogy of a school play where the stage is all dark and everybody's moving around. There's a lot of people on the stage, and then the stage lights start to come up, and we see a little bit more of what's going on and go, oh, and then a little bit lighter, and we see even more, and then the stage light comes up, we say, oh, well, there's all these people here. And he was saying that might be what is happening with this virus as well. I was wondering if you guys could respond to that, if that's plausible.
Well, I think that with the limited capacity for testing right now, we probably don't have a good idea of how many cases may be in communities. And I just want to point out that that is something that Lane County Public Health does not have a control over, the capacity for testing. That testing is being completed at the Oregon State Public Health Lab, and they have limited supplies to do that testing, or it's being completed at commercial labs. And again, even with our two large commercial labs that service our healthcare providers in our community, in our county, Quest Lab and Legacy, they also have limited capacity for testing. So I don't know if that really, it's getting better, but that also will take some time to ramp up, if you will, in order to. Certainly, there is not the ability to test everyone. And I guess from a epidemiological standpoint, that would be the ideal, right, to have that large of a denominator to know just how common this virus is in our community. And we certainly don't have that.
One estimate I saw was that 8% of the population had the flu last couple of years. That means like 20 million people get the flu. Not everybody gets hospitalized or gets sick or has, but it is a very common thing.
And that is the same with this illness. We also know that 80% of the individuals who have COVID-19 will have mild symptoms and a mild illness.
Mm-hmm. Yeah, I would propose that as the capacity for testing starts to develop, my analogy, being Air Force, not Harvard, is we cast a broader net. Maybe that's more Navy. But that's that. I think we're going to cast that broader net, and we're going to start developing more and more of a picture of what's going on. And I like to, I'll borderline quote Dr. Leitke in the sense that it's only been here a couple of months in the world. So we're going to be learning more and more about this. The fact that we recognize it's not an airborne, but it's a droplet issue is a huge step forward in terms of the management of this disease process.
I think nets, actually, that's more zoology.
Zoology? Okay.
All right, Mike, you had one more comment?
Yeah, I think what you just said is a huge thing. I think simplifying this message is important so that people understand you can't get it from breathing the air with somebody, you have to touch a surface. So that whole don't touch your face and washing is a really critically important piece, and that's why, because of what you just said. I think that basic communication is really, really important. Taking off from some of what Alan said, I want to ask more pointed questions, but I don't want it to seem confrontational, oddly, but that's how it's coming out in my head when I'm hearing some of this. So can you tell us how long it would take for us to have I don't know what a better word than appropriate is, testing capacity?
I certainly cannot, no, because we are not doing, Lane County Public Health is not doing the testing. This is not, this is a testing process that needs to be done at a higher level test, or lab.
Sure, because everybody, you can't get it done at the corner pharmacy. This
Right.
is something that's got to get done, yeah.
Right, exactly.
And by
So-
those evil pharmaceutical companies, right. So, sorry, couldn't help getting in on the politicizing. Isn't that something we should be talking about a little bit, though, at the city level for the sake of everybody's information, knowing some of that from the state? That's, for me, this is the kind of basic questions that because you hear these numbers, ranges of things, you hear people's fears leading to all different manner of information floating around. Best information is something that we can do, and I'm hoping we do well. While we're gone on this break, that would be, I would think, job one, job two, to be prepared. I don't know, other than budget authority, what you will need us for when it comes to decision-making, because you're already vested with most of that. But I will tell you that I think keeping us briefed regularly, especially if there's going to be something we're going to want to respond to, is really important. If there's something that it would help even though you have the chartered authority to do X, Y, and Z, I think it might be wise also to consider the times when, even while we're on break, calling us together to take a council vote on something just for the sake of making a community statement that we're going to do something if that appropriate day comes and we get to that place. That would be wise, and I'd certainly be willing to do it because I think that role may be important at some point. So.
And I think I'll just take another opportunity to plug that it would be great if all of your electronic IT equipment was up to date and checked out by city staff. So if you didn't have an opportunity to do it today when you came in, let's make an appointment so that if we end up needing to do a meeting, we could potentially do it virtually if we need to. So.
Thank you very much.
Yeah, I think we'll probably wrap it up. I just wanted to say one thing, which is that I think that the information that the county has posted has been extraordinarily helpful. I like your videos that you've done, and that most of us have social media outlets, and we can share that very good information that the county has presented to us. So, we actually, everybody in this room, we actually have the capacity to help get that word out, and maybe that's part of what we need to be doing is for our respective networks. Okay, I thank you very, very much. It was very helpful and informative, and we appreciate it. Not at this meeting, no. No, sorry. Thank you. We are not taking comment at this time.
Dude,
We're not.
down. Okay. We are.
We are, actually. So Monday night is a time for comment. You had an opportunity on Monday night.
I wasn't here.
Well, there you go.
Yeah.
Okay.
We're right between California and Seattle.
Next item, please.
Yeah.
See how unprepared you are? Your security is too
Oh, this
late.
is
You
exciting.
didn't even check my security. I'm not armed or anything, but this place is a joke.
Hey, dude.
No, hey, dude, no.
Yeah, we just move on to the next item, Mayor.
Yes, yep. Okay. Thank you. All right.
Wouldn't mess with Christie.
I wouldn't mess with Christie either.
I think they could do it. Sorry.
That's what's coming.
a freak
That's
out.
what's
Just say
coming.
something
Yeah,
real quick.
yeah,
I just want to say that was obviously inappropriate for a dude to respond that way.
We'll get Laura.
But his fear was real.
It's the real, yeah.
And I sense that. That's why my questions are so pointed.
Yeah.
Because I'm sensing that level of fear in a lot of the communications I'm having. And I just want to say again, I'm not sure we're responding to the level of fear in the community. I'm not saying we should be locking things down.
I understand that.
I'm not saying we should be canceling things. I'm just saying that we should be over-communicating.
Correct.
About what to be concerned about, what actions to take. And I'm not sure we're at that level just yet.
Yeah, and I just want to also say, it's a little bit of a misnomer to call it a council break. We don't have any scheduled meetings. We always have the ability, the mayor has the ability to call you all back together as we need to, and we'll keep you informed. I agree with you. I think this is the first time that there's been a message from the city manager to the community out on our website. I've been doing my own bit of social media just to make sure people know we're paying attention, we've got it, we're working on it, and we will take the appropriate actions when we need to.
Thanks.
Okay. Thank you. And I think we're ready for our next item of business. Thank you so much.
Thanks. Indent new paragraph. This will be a bit of
You
a
are doing a
shift.
great job. I
Okay.
saw you.
Still related to public safety.
That's right. Y'all should actually stay.
Welcome.
Mayor and councilors, I'm Chris Henry, the Transportation Planning Engineer for the city. Thank you for the opportunity to speak with you today about lowering speed limits on residential streets. We're going to talk about the Vision Zero policy framework, the effect of speed on crashes, Senate Bill 558, the possibility of implementing a speed limit change, a community campaign around 20 is plenty, and next steps that we may take. Back in November of 2015, this body, by resolution, set official Vision Zero policy of 0 fatalities or serious injuries on our transportation system. That was followed in March of 2019 by a adoption of a Vision Zero action plan by administrative order with a goal of 0 traffic-related fatalities or serious injuries in the city of Eugene by the year 2035. The Eugene Vision Zero action plan identified speed as a factor in crashes causing injury or death, and slowing vehicle speeds as a strategy to reduce harm to people in a crash, and action to support legislation allowing local control to designate speed limits. Locally, nearly 1 in 3 of the fatal and serious injury crashes occur on streets signed at 25 and 30 miles per hour. Speed is recognized as a priority as the fundamental factor in crash severity. We know that speed is the most critical factor in whether a crash occurs and the severity of outcomes. This graph helps demonstrate the likelihood of death or serious injury related to speed in a crash. And at 20 miles per hour, there's a 10% likelihood of death or serious injury. That likelihood increases dramatically as speed increases in a crash. Senate Bill 558 allows cities to designate speeds on non-arterial residential streets 5 miles per hour lower than the statutory speed limit. Senate Bill 558 allows the city of Eugene, through ordinance, to systematically reduce 25 mile per hour statutory speed on non-arterial residential streets to 20 miles per hour. Allowing those speeds to be reduced on these residential streets supports our community goals for safe interactions between people driving and people of all ages walking, biking, or using mobility devices. From a triple bottom line perspective, reducing harm to people supports a healthy community. Making our streets safer for people who walk, bike, use a mobility device, or ride the bus supports our community climate recovery goals. Reducing crashes and the financial costs of harm to people and property supports a healthy economy. In order to implement the speed limit change, we would need to change out a little over 600 signs. We've identified funding of a bit over $30,000 to make those changes, and we would focus on residential streets first. We would install signs in the winter months with our sign crews approximately over a year's time, and systematically deploy the sign replacements geographically, perhaps by neighborhood or region within the city. And then later, we would evaluate collector streets on a case-by-case basis. We would couple that with a community campaign to inform people of the change and coordinate deployment of speed feedback signs. Those are the signs, the LED signs that tell you how fast you're driving. Here are some examples from Portland, Seattle, and the United Kingdom using a 20 is plenty community campaign. We could do something similar here.
I like the snail.
Your action today is you may direct the city manager to set a public hearing on a proposed ordinance. The next steps following that would be council consideration of public hearing testimony, consideration of an ordinance, and your decision. We also have a potential to use the Engage Eugene platform during the decision-making process to receive feedback on a proposed ordinance. Following your action to adopt an ordinance, we would install the signs on local residential streets and implement a community campaign for 20 is plenty yard signs. Thank you.
Thank you. I'm with Alan. I like the snail, but
God, please,
Okay.
no.
I was just thinking that you could do it like, if you do it in honor of Sabrina Ionescu, probably everybody will be on board.
Good, okay, I have Mike, Alan, and Claire so far. Take it away.
I'm all with you on that one, Sarah. Absolutely right. As long as no one proposes putting a slug on the thing. Anyway, for the love of all that is holy. I understand
Next to
the,
a slug queen, you know.
I'm aware, and I'm sure part of Eugene is, no, anyway. The obvious safety of traveling slower is quantified very well there. I get that. Why is my question. Why now? Why the change? Why?
The severity of outcomes is reduced.
I get that.
So why?
Yeah, I mean, what
Because
occurred that has made this now something we should do instead of a year ago?
So we have policy guidance through your resolution to eliminate fatalities and serious injuries. And through adoption of our Vision Zero action plan, we identified an action to support
There we go.
legislation. That's the why.
Because
This is
Vision
the action.
Zero
Yes.
suggests this will help make everyone safer.
I mean, the timing is really, we've been lobbying for this for a while, and we just got the authority.
State authority
through the
to do it,
legislature to do
right.
it.
Got it. And thank you. That's what I was looking for. I agreed with Vision Zero. I voted for it. I really wish that the council would do all of the things that are in keeping with the idea of that, and I support all of them, including the idea of stopping the encouragement of people jumping into the traffic lane from intersections, which we still do. I hope we'll revisit that choice at some point and begin to discourage people from entering the travel lanes in front of cars that are moving from intersections to get money. Thank you.
Alan?
So what are the downsides of reducing the speed limit in the residential neighborhoods to 20 miles per hour?
If it's not coupled with an information campaign so that people are aware of what the new speed limit is and some level of enforcement or compliance with the speed, then people's behavior may not change. It's an opportunity for us to do something that feels good that may not necessarily do good.
Yeah, that's the campaign. What would a traffic ticket be for going 25 into $20?
I don't know that. I don't know that. We can follow up with that information. I'm not current on citation levels.
Yeah, some citations will be issued, but most of it's got to be this campaign. To quote my colleague, Councilor Pryor, this is a duh idea. This is a modest cost. The saving, the safety increase is pretty dramatic. We finally got the authority to do it. I think we need to move forward. It's a modest cost to do this. If you're one of the people who've been seriously injured or hurt, $30,000 means nothing. I think the statistic that one slide made, put it back up again about the speedometers, at 20 miles an hour, 10% likelihood of being fatally or severely injured. At going up 10 miles per hour, it quadruples to 40%, and then going up another 10 miles an hour, sevenfold increase, 70% increase, 70% likelihood. I think that's really dramatic. I mean, that's where the speed kills comes from. So I think you're right about it might be a feel-good thing if we don't do anything about it. So I think the campaign is really important. And what Mike said about people, I think part of the campaign needs to be people following the laws. So we're just at a Franklin Boulevard transformation project open house yesterday, and one of the conversations was at Walnut or thereabouts. A young lady was killed walking across, and I'm not sure if this is correct, but apparently against the light. And so, having a campaign that says follow the rules, people don't put your life at risk by not doing this. And so I think that the campaign 20 is plenty is a really good idea. Maybe we can get Sabrina to do a PSA
Yes,
wearing her jersey.
totally doing that.
Yeah.
I wanted to do a hand washing one too.
All in favor? Aye.
Sabrina, if you're listening.
All right.
If I may expand a bit on Vision Zero, the goal of reaching zero fatalities or serious injuries in our transportation system requires a multidisciplinary approach. We recognize in that approach that people make mistakes and that we have a responsibility to engineer, design, and build and maintain our transportation system in a way that's forgiving to people. We also have to enforce the laws that we have. And so it's a shared, and we have personal agency and responsibility for how we behave in that system. So changing the sign is a thing that we can do, and we can also do other things like redesign our streets for safer outcomes and enforce the laws that we do have.
Yeah, I commented yesterday about 19th Avenue, which has just been transformed, and with the bump outs and the raised intersections, and how dramatically just that infrastructure changes the speed on that street. I've been driving on that street for 30 years, and I know first time I went down the street, I went, wow, I'm going way slower. So yeah, there's lots of infrastructure we can do, but it also is a campaign about speed limits too.
Great. Thank you. Claire?
Thank you. Yeah, I am definitely in support of us adopting this motion and moving this to a public hearing. I'm very pleased to see this progress. Just to point out, as has already been pointed out, other things that we've been doing to ensure working towards our Vision Zero goals. We now have an actual traffic enforcement team out on the street, thanks to our new chief and some of the funding that this council has supplied there. And I was just at a meeting with some of our local law enforcement folks recently, and they were commenting that the chief said, warnings are fine, give a lot of warnings. Let's just start changing the culture out there on the street in terms of driving behaviors. And then our Safe Routes to School program, which encourages kids within a certain distance of middle and high schools to walk or ride their bike. That has become a much more established part of our local education system in the past several years, with the kids getting education on how to safely walk and bike in their neighborhoods. And then, as you just pointed out, re-engineering our streets, our bike paths and sidewalks to kind of get that completer picture. And I just can't help but point out, not only will humans be more safe if we reduce our speed limits, but dogs, cats, and squirrels will, in our residential neighborhoods, will also be more safe. It always breaks my heart when I see that squirrel that was running across the street and didn't make it. So even that 5 mile lower will help. No, the turkeys will still be a problem.
Probably not possible.
20 points for turkey.
Jennifer?
Use squirrels, not snails.
Thank you.
Slugs.
So I'm like kind of off track. I'm thinking about turkeys now. So I think adopting our Vision Zero is something we should really be proud of. It's not a small thing. You know, it really makes us rethink a lot of our decisions that we make. And I think it's great that you are bringing this to us. I think it's probably a small thing in comparison to some of the other things that we're going to be asked to do as time goes by. I got a chance to meet Logan. He's our new Vision Zero planner. I'm not sure his exact title. He's fantastic, by the way. I met him with Safe Routes to School, and he was sharing with us some of the infrastructure changes that he really recommends, and then just like changes to our street environment that encourage our people to be safer, that you don't really notice, but it kind of makes you change your behaviors. And these are the kind of things I'm really looking forward that we're going to be integrating into our city. So I'm very supportive of this. I think, like Alan said, it's duh, yeah. Why would you not make these changes? And I think, obviously, having the campaign is a huge part of that. Probably even more important than the signs is getting that education out there so people know, why am I being asked to do this? Why is this important? That slowing down just a little bit, if it's going to save lives or save people from having huge changes to their lives, is clearly worth that few more minutes that it might take you to get across town. So thank you for bringing this forward.
Thank
Just
you.
to clarify, it was Councilor Pryor I was quoting.
Okay. It was not Alan. It was Council Pryor
Captain
being
Metaphor, you'll be
visioned
Captain
through.
Emily?
Thank you very much. I think that this is a good idea. I'm glad that we can do it now. How big a road does this affect? Are these just little neighborhood roads? I've had for years concerns about Jefferson, and I know that we're doing some work to ease that situation. But that's a question, 18th, 19th, I met somebody who was hit on 19th in Hilliard last fall. How far-reaching is this?
So it's non-arterial residential streets. So it could include neighborhood collector and major collector streets, but not minor arterials or major or principal arterial streets. We're going to start with local residential streets. Those are the ones that are typically signed at 25 miles per hour, and we usually have signs designating the speed when it changes from something else. So if you leave a busy street and turn to a residential street, you'll see a 25 to let you know. Those are the signs that we would change. Later, we will look at on a case-by-case basis at those collector streets. Jefferson would be an example of looking at that on a case-by-case basis.
I wonder if we shouldn't move that up a little, since many more cars travel on those collector streets than on the small neighborhood streets. So percentage-wise, we might avoid hitting people more on the collector streets. So I like this. I mean, great, but I get more complaints about the collector streets than the little neighborhood streets. So I would reverse the order. But I'm really grateful to it. And I'm looking forward to it happening. Thank you.
Mike, another comment?
Yeah, I just wondered, how does this interact with or affect our city's overall, what do you call it, traffic standard rating? Like a year, 2 years ago, when we voted to go from a D to an E, how does this affect that?
Most of these local streets aren't part of that signal network where we evaluate the mobility standard.
Mm-hmm.
And that standard is citywide, typically at signalized intersections.
So it's intersections rather than on the roads themselves?
Right.
Okay.
Places where people interact.
And so you're saying essentially that this will have no impact or effect or interaction with our decision to alter that standard?
I wouldn't say no effect. I'd say that it's not likely to have an effect on the mobility of the system and the places that we measure that towards a standard.
Okay. I see Sarah trying to
Look,
say
I
something.
see it creeping behind me.
Yeah.
So Matt Rodriguez, I'm the acting Public Works Director. I just wanted to add, so typically when we looked at that mobility standard, and Chris said it, that's about delay at an intersection. We're talking about lowering the speed on a segment. So they're really kind of different things. So when you're looking at delay at an intersection, it's typically how many people are trying to move through it, not the speed at which they're moving through it when it's green.
That in a particular place.
I think it's unlikely that this change will affect any of our level of service standards.
Okay. The reason I ask that is because it's most common in North Eugene, where it's horrific at times, to encounter slow speeds as something that backs traffic up farther. For example, 3:30, 4 p.m., if you try to travel down Crescent or towards Delta Beltline, that's a good half hour to 45-minute wait to get a mile down the street. So I know that this doesn't affect Crescent, but all the streets that feed into it then have some degree of effect here, whether it's Cheryl and Sarah and all the residential streets that are along Crescent there. So you don't think that's going to make Crescent worse, for example?
Non-arterial streets that are residential streets, and so we have to apply that lens to what we're looking at in those effects. From memory, I can't say if Crescent is a minor arterial or not.
It's shocking that if it were not, under the circumstances.
Yeah, in that case, it's already in one section of Crescent is 25 miles per hour.
As soon as we put a Winco in there too, it'll be all kinds of fun.
Well, that's where the speed limit's lower. Well, I mean, excuse me, back up, I was thinking of the Walmart end at the west.
Yeah.
Matt, do you want to just talk briefly about kind of the monitoring the traffic maintenance team does on kind of the queuing and movement, just a little bit?
And if I
So
could
people
just jump in there.
understand that
The reason I bring this up is because I get hit with it almost daily. Not quite as much as other things where I do get hit daily, but on this one, especially from some key residents of my ward who are particularly unhappy that we're going to allow Winco in the old Shopco building over there at Coburg and Crescent that they think is going to make the worst street in the world to travel, or, the worst street in town to travel down in the afternoon, much, much, much worse. So I'm looking for slowing down speeds. How is that not going to make things worse? I want it worse. I want to be able to reassure them.
Sure. So just to briefly hit that once more, typically the delay when you have rush hour and things like that, it's about the number of cars you're trying to get through an intersection. So you're just trying to squeeze a lot of people through a small space. If you had half the cars and they're going 20, you're still going to get people through a lot quicker. So as far as what our traffic operations team does, so they are actively monitoring the traffic counts in the city. We've actually added capacity for a couple things we call cameras on a stick, which we can actually attach to a pole and videotape an intersection to see how it's working, and then we can adjust our signal timing. We have some Bluetooth readers that use anonymous data. You can't tell who's using it, but you can actually track someone down a corridor anonymously and understand how long it took them to get through. So those are some of the tools that we're using to make sure our system's working efficiently. And we also are upgrading our signal equipment infrastructure to more capable, what we call signal controllers. It's kind of the computer, the brain of a signal system that can actually be a little more dynamic in how it processes people moving through an intersection. So as we grow, that is work we'll have to do to keep making sure we're moving around efficiently.
And safely.
Yeah,
I'm fine with our vote today and voting to implement this. I think it's a good idea, frankly, in residential streets. And I would say that just by the number of times I drive down a street where there's already a sign that says, drive like your kids live here.
Yeah.
Right? I mean, I'll never forget the first time I saw that sign, I went, okay, yeah, right? And it altered the way I drove. I think maybe we should just hand out those instead of the snail, but,
That's what the yard signs are.
Yeah.
Something like 20 is plenty gives people the opportunity to put that sign in front of their home.
Yeah. The no slugs, please, for the love of God. The other piece, though, I'm going to get into the density question and that. I just won't do that today. I'll back off of that. Thank you very much.
Claire?
I'll pass.
Okay. Anybody else? Yep.
I hear you have a garden, and I know a lot of slugs.
I got the greatest killer for them, too. I kill them all. Quick, too.
Scissors are good for that.
I kill
I
them all.
hope you use beer. I move to direct the city manager to set a public hearing on a proposed ordinance to designate a speed limit that is 5 miles per hour lower than the statutory speed limit where authorized by state statute.
Second.
All in favor? 1, 2, 3, 4, 5, and none opposed. Thank you very much. Thank you for that presentation, and we are adjourned.